Dental implants are basically mechanical roots of teeth, so we can place those in the jaw bones, and they can use those to place prostheses, crowns, or bridges. So it's a mechanical root that we can engage the parts for the teeth to be placed in a permanent fashion for patients.
Patients would need or require dental implants because they're actually missing a tooth or several teeth. And this can occur naturally and may have not been born with it. It could happen with trauma or pathology, and sometimes just normal wear and tear. During the consultation for a dental implant, we have to assess the patient's health history. We understand the patient in general first to make sure they're healthy enough to undergo dental implant procedures. Also within that consultation, we obviously a physical clinical examination of the area. Also, we use diagnostic techniques such as three-dimensional scanning. We call this cone beam CT scan. We also, in the clinical exam, will determine if other teeth need to be addressed, be it with implant dentistry or with regular dentistry, or orthodontics may need to be brought into the picture to align teeth more properly so an implant can be placed in the right position for the patient.
Treatments, again, can be done with just a local anesthetic. I describe to patients, they say, it's going to hurt a lot, isn't it? And no, it's less trauma than having the tooth taken out that you had when you lost the tooth. So, and putting a bone graft in, waiting for that to heal is often part of that process. And then the implant itself is pretty straightforward. It's a small incision. You just make a small hole with a burr, size it out, and then you put the implant in. It's very straightforward. For an implant recovery, usually it's less than taking the tooth out, so it's a day or two of the gums being sore. Rarely do we have patients calling in and complaining of having any discomfort from having an implant put in.
Patients can find out if they're a candidate for implant treatment if they come in for an evaluation. And again, the evaluation process is going to let them know to what extent surgery would be, what procedures they have to do prior to implant surgery, or if they can just simply have an implant placed.